Good day, everybody. Welcome to Dr. Tom's Tips on Tuesdays at 10 in 10. My name is Rolando Mia, and I am here with Dr. Tom Hirsch. So today, the thing that I want to set is that now that the CDC is basically telling us what we've all known from the beginning, which is COVID can be carried by aerosols, it's more important than ever to ensure that your team, your patients, and you are safe. So today, one of the key areas that we want to talk about is utilizing Isolite in hygiene, specifically around ultrasonic or piezoelectric instruments. So Dr. Hirsch, thoughts on or tips on using Isolite with ultrasonic or piezoelectric instruments?
Good morning, everybody. How are you doing? So these are my thoughts with the ultrasonic scalers, the piezoelectric scalers, and the air polishing units. Anytime we're using any kind of mechanical device, we are going to generate airborne aerosol. And it is so important for us to protect our staff from any problems that the air from getting COVID. I mean, I want to protect them from COVID. There's even a remote possibility I want to protect my staff. So in doing that, the option of using your mechanical piezoelectric scalers, your Cavitron, your ProVjet is all optional to you. A lot of people have backed off from using it, have just gone on to plain old hand polishing and hand scaling these days. If you choose to, and I'm not recommending that you do or you don't one way or the other, but if you choose to use these devices, then this is what I recommend you do to mitigate the airborne aerosol. Tip number one, make sure that you have your HVE, that you have your Isolite system vacuum on high. Turn them all the way up. That's going to pull in the airborne aerosol. So that's tip number one. And then tip number two, it's still generating airborne aerosols. So once again, have your second HVE right up next to that so that you can really evacuate things. I know we had a video, a Tale of Two Hygienists, I believe it was called. And Rolando, if you can run that, it's about a 90-second video. This is not mine, and I have no relationship with this video whatsoever, but I was just kind of cruising the web and I found this one. I thought it might be interesting to see. This is a hygienist. Or you tell it, Rob. You tell the story here.
Yeah, so this is Michelle Strange. She runs a podcast called A Tale of Two Hygienists. She evaluated 7 different kinds of evacuation units, and we want to share with you the experience she had with Isolite. So we'll go ahead and play this real quick. Can you hear this?
For the perfect sized mouthpiece, but Xyrus has a great one-on-one instructional video call to make sure you are comfortable with the sizing. The one thing I've had to learn is to adjust my fulcrum a bit when using the Isolite. The learning curve is not steep, but it does exist. And the patient mentioned that it seems like it was a bit much at first, but this ended up being the most comfortable for her because of the bite block. I tried it first by itself. It does grab all the water and most of the spatter and spray until you hit about the first premolar area. And as you come to the anterior teeth, it does start to bounce out of the mouth, the spray and spatter. So I added the second high volume evacuation that I am lucky enough to have in my room, and that made a huge difference in how I manage the spatter. It wasn't such a big deal with the PAs on ultrasonic, but when I did the airflow, I felt the second high volume evacuation was helpful.
Super. Thank you, Ro. That says a lot right there. The second tip, once again, is if you choose to use the Isolite and when you're using the Isolite, make sure you have that secondary HVE to go right along with it. For those of you that have the Isovac system and not the Isolite system, we have that dedicated to your HVE line. So there's a splitter that comes with the system. So tip number 2, utilize that splitter that takes a single HVE and makes it into 2 HVEs, one for the Isovac and one for your HVE. That's tip number 2. Along with tip number 2, yes, you will in fact get a reduction in the amount of HVE going on each particular one, but it's enough to really suck in everything. So that's my second tip of the day. One of the things that I had when we first came back from and starting to work after everything was shut down is I had resistance from my hygienist who didn't want to utilize the Isolite. Even though I invented the thing, there was just such resistance there until I made the mandate. You must use this. Why? Because if you get infected and you infect one patient, then we're going to spread it around to the rest of the staff, to our other patients, and I just don't want that route. So it was just mandated, and there was no discussion about it. If you didn't want to do it that way, then you were certainly free not to work any longer in my office. And I kind of said it that way. Now, one of my hygienists, it took her about 2 days to get comfortable utilizing the Isolite. The other hygienist, she said, it took her about a month and a half. So there is a learning curve. And the learning curve is just the fact that one of my hygienists said she couldn't remember where she was. She forgot what quadrant she was working on. And so that was just another problem that she had. Another tip is, as Dr. Strange said, hand rest. I literally use the Isolite as a fourth finger hand rest. So I rest my hand on the Isolite device itself. And so that's another tip that we can go along with. Isolite, Isodry, it doesn't matter, but turn the vacuum up. Oh, one more thing. What you'll also find is that the mouth can dry out when you've got the Isolite on high or the Isovac on high. So every now and then, just take a little bit of air water spray and you can put it on the inside of the mouth and just spray down the palate really quick. And that'll help quite a bit. So there's my third or my fourth tip of the day.
Cool.
What have I missed?
No, that's great. So Michelle Strange is an RDH, and she runs a podcast tailored to hygienists. Some great information there. The idea around utilizing a second, I guess, from a Xyrus perspective, I want to reiterate, as Dr. Hirsch said, we're not recommending or going against whether or not you should or shouldn't use ultrasonic or a Kevitron or scalers. That's up to you. But when you do, Isolite, very powerful at eliminating those aerosols and the droplets, the spray splatter, and then also adding a secondary HFE. Now, you also mentioned, Dr. Hirsch, you can actually hook the saliva ejector too, correct?
Absolutely. Anything that you can have the saliva ejector. So let's say you don't have two HVEs, then at least take the saliva ejector and get that saliva ejector right next to the area that you're working on. You can follow your piezo scaler, your Kevitron right along with the saliva ejector. So you can have the Isolite going full steam, and then also the saliva ejector right on the opposite side of where the piezoelectric scaler or the Kevitron might be. That works nicely.
Yeah, and the saliva ejector is a low speed, but the key is HVE. Yep. Any other tips that, any thoughts around light versus no light with regard to when you're doing any kinds of scaling?
The light is always nice to have. I mean, it gets rid of the shadows. One of the things that's nice about the Isolite, whether it's Isolite, Isodry, or Isovac, keeps the tongue controlled. I mean, you just don't have that tongue exploring, getting in your way all the time. The light is nice. Isolite is nice. I like the illumination. It makes my job easier. It makes my hygienist's job easier. They have the luxury of having the Isolite. Yeah. But whether you have the Isolite or the Isovac, they all work fabulously with the same mouthpieces.
Awesome.
And they give you exactly the same amount of suction and evacuation.
Awesome. Well, thank you for that. Hey, folks, please stay safe. Make the choice. If you do, system is phenomenal at that. If you have questions or would like to see other things have Dr. Hirsch cover, please let us know. If you like the content of this, please share it. Every Tuesday at 10 in 10, you can hear different tips, and we've gotten feedback and questions from people. So keep them coming. Really appreciate it. Thank you, Dr. Hirsch. Have a wonderful...
Thanks, everybody. And please be safe. Wash your hands. Wear a mask. Social distance, do the things you're supposed to do, and we'll beat this thing.
Awesome. Thank you, sir. Have a great week. We'll talk to you next week.
Bye.